Good afternoon and welcome to episode 2 of the Therapy Spot. My name is Scott and I am the facilitator, and welcome back to this space where we will be having therapeutic conversations. And before we start, I have one of my learned friends here, and he is a strong believer in his faith, so I'd like him to just say a prayer and bless us before we start.
Okay, let's pray. Father, in the name of Jesus, we give you thanks and we give you praise. We thank you for this privilege, this opportunity that you've given us, Lord, that we can come together as men to discuss and to have these conversations this evening. Mighty God, we pray that you will be in our midst. We pray that you will direct our conversation. We pray, Father, that everyone that is listening this evening, that, Father, they will go away taking something away. I pray that there will be change in the lives of your people this evening, Father, through these conversations. We thank you, Father, for this platform that you have given us, Lord, that we are able to share in this way. We pray for your leading, we pray for your direction, and we thank you for everything you have done so far, and thank you for that what you will do. We give you thanks and we give you praise in Jesus' name. Amen.
Amen. Thank you, Dwayne. Thank you for blessing the place. Before we start, I just wanted to kind of give an overview of why we're here. So this month is Men's Mental Awareness Month, and it's around looking at what impacts men and their mental well-being, and that's the theme for this month's show. And what we'd like to do is provide a platform where we can have therapeutic conversations and kind of challenge some of the misconceptions about therapy. So as 4 therapists who are black men, is to kind of highlight that therapy is accessible, that there is therapists that look like you, that sound like you, that have similar experiences, and that can help you almost become the best versions of yourself. And some of the people that I'd like to acknowledge who support the show: Carl Gracie Warriors, they're an M&A outfit based in Wembley. Courtney Margaston, his name's Mr. Sophisticated, he's a promoter, and Ray from the Breakfast Blues show. So they have supported this show to make it happen, and they're really interested in supporting the work that we're doing in terms of highlighting mental well-being. When I think about therapists, one of the things that comes to my mind is my grandfather used to always say to me, it's better to have something and not need it than to need something and not have it. So as therapists, I would really encourage people to get a therapeutic alliance with some type of therapeutic network to support them with their well-being. And I think I'm just going to go around and introduce everyone and ask them for just a little bit of information about who they are, what their therapeutic background is, and just start the conversation there. And we do have some questions. So before we started, I sent out some information to some people. So they sent me some questions and we had a conversation. So I hope that we have a interesting dialogue today about therapy and what it entails. And the first show that we did was around relationships, separation and divorce, and there were some conversations around narcissism. I think that's a subject that we'll have to kind of tackle it in its own right, because it's such a wide spectrum of some of the work that encompasses what we do. So I'm going to start on my right hand side. So this is
So I'm Dwayne. I'm what you call an integrative therapist, and what that means is that my modality or my training is psychodynamic and person-centered. So what that means is looking at the past and seeing how the past is having an impact on what's going on with the present. So I have been qualified now for, it's been about 10 years we started our journey, and I think we've qualified about 88 years ago. I think I saw my first official client in 2015.
okay.
That's me.
That's you. So me and Dwayne, we studied together. You're right. We qualified in 2016, and the model that we kind of use is the integrative model, where we blend different therapeutic ideas and schools together to support our clients. So thank you for that, Dwayne. And on my far right, I have
Ryan. Yes, my name is Ryan. I'm also integrative. I started studying in 2004 and I qualified in 2009. And since 2009, I've been working in an integrative sort of way, psychodynamic, person-centered, and a lot of CBT with the work that I do with the prisons and anger management work. Yeah, so that's me.
Okay. And you talked about some of your experience around working in criminal justice and working with men that have anger issues.
And women.
And women?
I used to work in Holloway prison. Yeah.
Okay.
Yes.
So we might delve a little bit
have to
into
delve
that,
into that because
into the
there's
nuances of working in both male and female
There were
prisons.
some ethical dilemmas involved, that type of work, but we'll get into that.
Yeah, I can see a smile on your face, so I can guess that is like a jovial kind of conversation. And last but not least, I have my learned friend here.
Yes, good evening, Colin. What can I say? I'm also integrative. I could never say that word properly. But I started as a person-centered. My training started in person-centered. Compared to you guys, I'm newly qualified.
Right.
2 years now.
That's
I've been qualified. I qualified as an adult counsellor, and at the end of the training, something didn't quite click. I needed something more, so I studied to be a child counsellor as well. So I did an extra further year as well. So I work with the youth justice system. I've worked in secondary schools, SEN schools, like special educational needs schools, and work is very varied and very interesting. So I love what I do. And my main profession is IT. I'm come from an IT background, so I spent 30 years as an IT professional.
30 years.
Yeah, and I'm still doing it full time, but part time I'm doing private practice.
Okay,
That's good. It's interesting.
yeah, thank you for that. And when you spoke about private practice, some of us here have had our private practice for quite a while in terms of seeing clients independently from services. But one of the things that came up when I was thinking about this show is, what made you become a therapist? What was it? What drove you to say, actually, I want to do this profession that's different from most people? So that's a question to all of you. What was your motivation for you to become therapists? What was the turning point? What was the thing that this is where I'm going to be?
I think annoyingly, I think I've always had like a passion of working with people, wanting to help people. So my whole journey has been about working and helping people. So I did a psychology degree. Then I did like several postgraduate courses, and then after that I did my counseling course. So, but it wasn't quite straightforward. So although I work as a therapist, I have a full-time job as well. So, but yeah, I think for me, one of the things is I've always wanted to help people, and I value confidentiality and trust. And so I recognize that for a lot of people, they didn't have that. So rather than expressing their thoughts, expressing their feeling, and especially with men, they internalize their feelings. And so I wanted to be able to offer that opportunity for people to be able to express themselves and what they're going through, to help them. So that's the reason why I took that path.
Okay, so it was around, you knew that you were this kind of helping nature.
Yeah.
And you wanted to develop it a bit further. So doing that postgraduate and your psychology degree, it kind of garnered more interest.
Yeah.
And I remember when we were studying from two different backgrounds, but we kind of clicked and we said, okay, this is kind of the motivation. This is what it entails. So when we were studying, it's a long process, and part of that studying is you have to invest in yourself. And part of the show today is letting people know it's around what investment do I make in myself so that I can develop, grow, become a better person. So if I was to reflect on that question for myself, what was my driving factor? I think I was working in a youth offending team in Wandsworth, and I was a substance misuse worker, and it was really weird when I got that job. I'm thinking, drugs worker job, that's a bit weird. But anyway, and I know I'm saying it's weird, but I used to get a lot of the young people that used to tell me their stories, their pain, their trauma. And I had that, which what I didn't know at the time was that Therapeutic Alliance. But I didn't know that's what it was called. I just thought me and the youth, them get on good.
Yeah.
And then there was a mentor that I had there. His name was Dr. Oliver Sindel, and he was a psychologist. And we, again, two different backgrounds. He's white, middle-aged, came from a different area. But he said, Scotty, why don't you try counselling? Have you thought about that? There's a reason why they're telling you this stuff. And I had a really supportive manager. Her name was Diana Manis, and she gave me some time to study. So on a Thursday, I'd go to college, and the more I studied is the more I got to understand about myself. And then the more I got to understand my own trauma and almost make a link as to why the young people were telling me. So I always had that helping nature, because I've done helping work for 20 years, but it was that interaction at the yacht where young people was sharing with me and I didn't know what to do with it. And that was my motivating factor. And I didn't train to like go into private practice and earn lots of money. I think that we are in a really privileged place as black male therapists who come from places where we know lots of people don't access therapy, 100%. And we're almost making it acceptable. We're making it's not something to be scared of. So that was my driving factor, to really share that therapeutic knowledge and so forth. So I guess my question to you, Colin, what was the
It's funny you say investment. When you said investment, I kind of thought of also the word commitment, because it's a massive commitment that you make to do this. There's a lot of things that you sacrifice. And for me, like I said, I'm in IT. I'm a troubleshooter. But for me, I didn't go into helping work. People just tell me their business, So people do. Everybody, I've got a kind of nature that people just tell me stuff, you know. And what happened for me? One of my daughters was going through something through adolescence, and she was really struggling. And I had to kind of step up in terms of being there to support her and what have you. And I spoke to everybody, my friends who had children, people then who didn't have children. Just there's no rule book about bringing up children. So two people were very instrumental in helping me with this was Paul Coxon, who's a counsellor, therapist for about 15 years at the time, and my friend Elaine, who works with young people. And they had this way about them. When I was talking to them, I recognized what empathy was. I recognized what understanding was. They had this way about that I felt heard and understood. Didn't know that was counselling back then, So I just reached out to them. We moved through our stuff, my daughter and I, and she's doing really, really well and everything's all good. And I kind of thanked and praised these guys, like, it really helped me. And I became intrigued by what they did. I said to Paul, what was your training? And I said, bro, you could be a counsellor now because look what you've done. So he said, why don't you just try and take an introductory course and see if it's for you. I'm in IT, so I've gone and found an introductory course. Think I'm going to go and sit down with book and blackboard and paper and sit down and didn't realize, like you said, you learn a lot about yourself. I didn't realize that learning about counseling is learning a hell of a lot about yourself. Absolutely. Yeah. And the class I went to, the tutor was a play therapist. So she does a lot of drama, very, very creative. So in the class, they'd say, stand up and do this or do that. And it was like how the class dynamics is. It's you sit in a circle and, everybody gets included, no hiding, So you have to be authentic. You have to be yourself. You have to come out. So you learn that what you said to me about, as I said just now about being yourself, that really resonated, because, or learning about yourself, because it was about personal development. So that drove me on to continue. And each year I passed to become a therapist.
Yeah. And that sounds amazing in terms of, on this journey, I started for one reason, but the more I did it is the more I became in tune with ourselves. And something that I want to reiterate, which I say all the time when I'm speaking to people, probably you guys say this as well, to your clients, to family, to people. We've all got stuff. We've all got stuff that we've experienced, that we've gone through, and it can affect you in so many ways.
100%.
It can affect your communication with your family. It can affect your communication at work. it can affect how you function in the world. And I suppose when you get that alliance with a therapist and you are able to be your true self in that therapeutic setting, because that's what we provide. We provide that space for people to be their true self, to understand their pain, to understand their trauma, to make sense of their life. And it's quite a privilege to have that as a skill, as a tool that you can use. So really interesting, Colin, and we're going to continue, because how I know Colin, I met Colin through family in South London, and outside of this place, people wouldn't know Colin. They would know him as, if you don't mind me, as a promoter.
That's right. Yeah, I'm a promoter as well. Yeah, that's one of my other strings to my bow.
Yeah, so he would be, and when I asked Colin to come onto the show, he was saying, boy, you know, people might, but I'm really kind of proud. And I've been with Colin on his journey and that, and we've had conversations, and it's just really kind of enlightening and special to see that growth and development. So, yeah. Ryan, tell me about you. Tell me what made you.
Okay, so my journey into therapy started from me being a client in a residential rehab, because I used to be addicted to coke. So once I finished my rehab, so I'll start from the beginning. When I was in the rehab and I was in the therapeutic groups and the one-to-ones, my one-to-one counsellor said to me when I was coming to the end of my therapy, he said that you've done some really good work on yourself. What are you going to do now? So I always liked, I was always interested in how people think. You know, I used to read books called Murder in Mind. There was about books about criminals, and I was always fascinated as to why someone done something rather than just judge them. So I was always interested in how the mind works. So once I got sober in 2002, I left the rehab. And I said, I'm gonna study to be a therapist. So my journey was very focused. As soon as I left the rehab, I knew that I wanted to be a therapist, because prior to that, all I ever knew was crime. Yeah. Right? Crime and drugs. So that was my way out. Once I got past the, my addiction process, and I finished my residential rehab, I went straight into college, and then I went straight through it, and it was plain sailing.
How challenging was that for you, making that transition?
Once I made the challenge, once I made that decision to go into a rehab, it was easy. But it took me a while to get to that stage, because my family, friends, baby mother, kids, my mum, everyone was saying, you got to stop doing this to yourself. And then once I decided to do that journey, because I never ever thought I'd go into therapy, because there's a bit of a stigma about that within not only the black community, many communities. So once I experienced being in a therapeutic alliance, so to speak, or therapeutic environment, I really liked it. I really liked it, because all I ever knew was, without giving too much away, violence, and there was no love in my environment. So once I got there, it really helped me, and I never looked back. I never ever craved drugs. Never ever. Once I stopped, I never ever have. I get that. So that was my journey into it.
You spoke about the journey and what you kind of faced in terms of yourself and not experiencing that true kind of safe space. And once you was in that therapeutic environment, you kind of almost, your thinking came back online, and you started to kind of understand yourself a little bit more. And one of the things around mental well-being is that a lot of people learn to mask their emotions when they're coming up, and because of trauma. So something that I was doing today, I was doing a presentation around adverse childhood experiences, and we was talking about adverse community experiences. So if we think about some of the communities that we come from, poverty, discrimination, poor housing, substance misuse. If we think about some of the factors around separation, divorce, all of these things can impact a child when they're growing up in terms of how they use to express their emotions, their thoughts, their feelings. And that's when you can develop what we would call defense mechanisms, where we start masking and almost becoming something that we're not, to protect our vulnerabilities. And I think it was you that said something, Cole, when you said, tell people my business.
Yeah.
So we know in our community is one of the things that everybody say.
Yeah.
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 When I talk for the business, when I tell, and there's that kind of thing around fear of how can I be my genuine self in this space? And one of the things that we do, we are all registered with the BACP.
Yeah.
And the BACP gives us a framework, it gives us a guidance. And one of the things that Dwayne spoke about is confidentiality, is about trust. And once we can develop that trust, it enables people to experience what you experience, Ryan, that kind of alliance in a process where I don't have to front anymore. And as I said, we're all messed up. We've all come from challenging
Strip
places.
yourself bare.
You got to strip yourself bare.
Absolutely, yeah.
Yeah. And I think that as men who supporting men, because some of the work that we've done, so I met Ryan, we was at a project in Islington,
Everyman project.
the Everyman Project.
Wow.
Was you there as well?
I think we've all done everyman. Yeah.
Did you do Everyman?
No,
Cole?
no, no. Didn't.
Yes.
So Everyman, so since you guys are there, tell us a little bit about the
Yeah,
what
what
was
is-
the
what is it?
Everyman? What was the Everyman?
It's a domestic violence perpetrator program, and I was there as a group facilitator and a one-to-one therapist. But I think not all of the clients that were sent there were domestic violence. Some of them were just people with anger management issues and abusive behaviour. Yeah, so that's what it was mainly about. But unfortunately, it's closed down now,
It's closed down.
and it was doing a very good service. That's where I met Scott and stuff.
Yeah.
It's interesting. Yeah,
So
I didn't realise he was there.
Yeah, I was there from 2015 to I think 2017.
So you know Roger?
Yeah, he was my supervisor.
Oh yes, that's
So-
right. He's the main supervisor.
he's
yeah.
a main
Yeah.
supervisor.
Yeah. So that's where I did my placement. So that's why my specialist area. Because that's when I heard you say anger management, I was thinking that's my specialist area because
Yeah.
I guess that's where
So
I
you
was
used to work in
trained.
Archway as well?
Yeah, so I first started off at Elephant and Castle because I used to have a branch there, and then I ended up in because the Elephant and Castle branch closed down, and
That's
then I ended
right.
up at Archway,
Archway, yeah.
as well. Yeah.
Yeah. So that project, the Everyman, I think the clients that we got, they did 12 weeks of one-to-one therapy, Cole,
Yeah.
and then they had to do, is it
16 groups.
16 weeks of groups.
Yeah.
Okay.
And a lot of the referrals that we got were from social care where
Kafkas, child services.
right where
Family
fathers
courts.
wanted to get access to their children, but as
Okay.
part of their I mean support package, they had to undergo that intervention. So
So
it's
you must have saw a wide range of presenting issues then.
Absolutely.
yeah.
Yeah, I mean, the main presenting issue was anger management, right? And domestic violence. But you had the dual issues. So some of the people will come in and they've got mental health issues. They've got addiction or alcoholism issues. So it was very interesting work, I thought. Yeah. You know?
Yeah, it was. And I suppose when Dwayne spoke about that was where he did his placement, just to kind of give you an idea of the journey that we've kind of taken. Part of this process of becoming who we were or becoming therapeutically trained is that you have to undergo certain training, but you also have to have placements where you hone your craft, you're getting your skill set. So there's those core things that we do, like active listening, paraphrasing, relaying back, but then we get our understanding of our boundaries around confidentiality. And in those placement hours, sometimes to get the BACP, I think it's 450 hours you need to be registered. To become a member, you have to have done a course that is accredited to the BACP. So one of the things that I want to highlight to people listening, to men that might be tuning in, is that mental health is something that impacts us all.
Yeah, absolutely.
We've all gone through situations in life where our mental health might not be 100%.
Yeah.
So I look at depression as a spectrum. There might be days where I might feel a little bit down and all I want to do is stay in my bed. Am I suffering from depression, or am I just at a point in life where I just want to take it easy? I might have had a relationship breakdown where that affects how I'm seeing the world. Something that's impacting a lot of people in our community now is around bereavement.
Yeah.
We've had so many losses in our community.
Yeah.
And how do men cope with that when you have a loss? So I just wanted to highlight that in our profession, there's boundaries that we adhere to. And there is a certain amount of skill that is in the therapeutic work. We're not just there gassing. There's theory that underpins what we do. And when we spoke about our modalities, that's the kind of theoretical kind of framework that we use. So if we're doing person-centered, we're working in the here and the now, what the client's presenting with. If we're doing psychodynamic work, we're looking back. And I think the question that came up is, what is some of the most presenting issues that you are getting faced with now with your client work? What is it that men are presenting with now? What are some of the main issues? So I'm throwing it out to you guys.
In
your
my
client
private work, the main issues that I'm getting presented with are men phoning me up about their relationships. But in the work that I do with agencies, for like the prison work, or when I was working with Cranston, it was mainly to do with people with addiction, mental health, offending behaviour. So if I just stick with my private work, it's mainly relationships and how to manage their relationships, because I can't really talk about the work that I'm doing because confidentiality. So that's the main thing, how to have a healthy, compatible relationships without the abuse and without the abuse. So that's what I'm working with mainly in my private work.
So it's important that you said that, because I'm reflecting while I'm listening to you around what is a healthy relationship? What's an unhealthy relationship? If you've never experienced what you unconditional positive regard and love,
Absolutely.
how can you then enter into a relationship? And I think this might be a subject that I'll come back to around, how do men communicate? Are we communicating differently to women? Are women understanding what we're saying? And like our emotional intelligence, so much of the clients that I've worked with, they lack emotional intelligence. They don't know what they feel. They don't know how
They
to
can't
express.
articulate their feelings.
Yeah.
Is that what you're saying? They find it hard to articulate their feelings.
Yeah, like when you speak, like if we go out on the road and we're chatting to a man on how you doing, bruv? I'm good,
Yeah.
I'm okay.
And it's part there. It stops. It stopped there.
But when you really check it, and if you have something, they go into different parts around how they're feeling. And one of the things that I say we can do to help other men understand their emotions, if you are kind of got that emotional literacy, is to use emotive language. So to express to people, actually, that made me feel like this, or I felt misunderstood, or it's not a conflict. Actually, I wasn't sure what you meant by that, and I want to be a bit more curious. So for you, Ryan, it's around relationships. Dwayne, what's some of the main presenting issues that men are coming to you with today in your work? What have you noticed? What's the trend?
I think one of the things I've noticed for me, so most of my work is around anger management and you see the relationship, but I'm also now noticing that there is a lot of presenting issues to do with depression. Like men are feeling quite low. And sometimes I know people, sometimes we throw around the word depression, and as Scott, you were saying before, that a day you might just feel really low. So I wouldn't say that's really depressed. So sometimes I would just probably look at it and say low mood. So, because it varies for me, but that's one of the main things that I'm noticing at the moment is a lot of the men are, they're experiencing depression, low mood. There's lots of things that's going on for them, and they just lack direction. So not feeling good enough about themselves. So it's just helping them through that.
Okay, so low mood and depression.
Yeah.
Okay, sorry, Carl. What's some of the things that you've noticed?
It's a combination, because the depression, I see that in the work with the young people, especially the ones in the criminal justice system. And it's interesting what you say about masking, or not being able to express your emotions, because I see a lot of the young people talking about emotions is wet. No, I can't talk about that. No, I'm not talking about my feelings, how I'm meant to feel. So I see that a hell of a lot, that they find it very difficult to express how they're feeling, B, to actually understand what they're feeling. It's like, how does that make you feel? That's one of the top therapist question. I don't know. You know, so it's for us to kind of, sometimes I feel like a treasure hunter, trying to dig and be more curious, to find out what it is working with the client, what it is you're actually feeling. You know, how do you express that now? You know, and it's interesting that you talk about anger management, because on the top of the anger, you know, like we do this anger iceberg, and on the top of the anger, there's a whole heap of other emotions that what I find. I've got a little exercise I work with the young people, and I show them the anger iceberg, and I say, let's walk through a situation. This is the anger at the top. Circle all the other emotions that came up during this, and you got, you know, felt unheard, misunderstood, not listened to, and these are the things that we start to work for. So I think it's emotional literacy is very important for the young people, for everybody, you know, and actually expressing what's going on for you. And this is what our role is to help somebody or give them the blank canvas to express what's going on for them. That's what I find. So definitely showing your emotion, expressing your emotions is a big thing with the people that I work with.
Okay. And what I'm picking up, you spoke about young people, but young men or young adolescents, they turn into men. And if they haven't had that nurturing, this is when they come men, and they find it really challenging to understand their emotions, what they're thinking. And then they enter into relationships. Sorry, Ryan, you use the word baby mother. I try and challenge that word most of the time, because in our community, we've normalized what I would term as a disrespectful way to actually address the mother of your child or the father of your child. And it's language like that, that in that therapeutic space, we can challenge people to actually, why did I speak to the mother of my child like that? No, she's not just your baby mother. Like, you can just chat to her. So I think what we provide in the space as well is challenge, but respectful challenge. So for me, in my work, what I'm finding now with a lot of men, their presentations is around their emotions. It's around their relationships. But there's almost now this, what is a man? There's so much that we're impacted by now. Social media telling us what men should be, how men should act. A lot of the men now, you talked about, they don't know where they sit now. They don't know where they fit. They don't know what I'm about. Who am I? How do I function in this world? So that thing around low mood and depression. So we've got lots of societal pressures. Money, house, success, what makes a man successful. So men are trying to live up to those expectations, and then we're trying to navigate our way in the world, and it's challenging. There's so much pressure now. And growing up as a young person and seeing like my parents, my granddad, I grew with my granddad, there was a different pressure that they had. They didn't have the same pressures that we have now. So I can see why mental health is so important. And when we think about black mental health, the data out there is quite shocking in terms of black men and mental health, in terms of mental health services. So in terms of being sectioned, we're 3.5 times more likely to be sectioned than anybody else. In terms of accessing talking therapies, black men access it the least, but we need it the most. And the reason why is because of those old stereotypes that we have in our community. We don't tell people our business. Sorry, Dwayne.
No, it's interesting you say that, because so I'm from a West Indian, Jamaican background, and he said that whole concept about don't tell the people your business. And sometimes if you go to I remember if you growing up, I don't know if anyone's ever been to someone's house where there's like this plaque thing behind the door, like what you see here stays here. And I don't, do you know?
We've seen them. What you see here stays here. What blah 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 blah. And it's almost as if we've been conditioned from early not to talk.
Or to show any vulnerability.
And when you were speaking earlier, Ryan, a lot of us, we've grown up in spaces where what we've experienced, because we was in that environment, we normalized it. It's not normal to see man getting run down with chopper.
No,
it's not normal to see people walking around addicted, and so some of us grew up in those environments where we were seeing that on a daily. So we've normalized abnormality now. and then we've kind of internalized that where we've become cold. We
Desensitized to it.
desensitized. So in our work with young people, I mean, Colin, you're doing lots of work with young people. I've done some of the things that I find with young people now, especially young men, they've become totally immune to their feelings.
Such a challenge. You're 100% right there, because it's such a challenge. Like I say, when you're speaking to them and you're trying to be curious about what's going on for them, they don't actually understand or know themselves. So you have to give them certain tools to try to find out what it is. What is it am I experiencing, you know? And
How do you think we can break that cycle? Sorry to cut across you. What do you think we can do to break that cycle of not being able to, open up and show vulnerability?
As a community, as for Black therapists, what do you guys think? How do we break that aspect?
I think one of the things is about conditioning, and like with the young people, young men growing up, I think there are some phrases or some things that we say to them. You know, if you see someone being vulnerable, it's not like, I was speaking to someone today, and we were talking about, and he's experiencing some grief, and it was like he finds himself occasionally, quite tearful, but at the same time, you will be told, "Oh, big man don't cry."
Yeah.
And
kind of
we
stuff,
do that with little boys, like, you don't cry, you're a boy. And I think some of that we need to get rid of it, because we need to say it's okay to express your emotion. It's okay to talk about what's going on for you, rather than internalizing those feelings that you're experiencing. So I think from a young age, we can start changing it in that way, and make it okay to let men know that it's okay to express your emotion. It's okay to cry. Like, a few weeks ago, a few months ago, I was really overwhelmed by a really nice gesture that my church had done for me. And someone said to me, "Oh, like, men don't cry." And I was like, don't say that. It's not. So we're constantly hearing those messages. And when we hear those messages, as men, we're not going to want to express, because there's negative connotations that come with that, with men who cry. There's lots of different things, and especially in the Black community. So a lot of people tend to hold back and internalize what they're going through. And if people are really feeling something, they'll just say, like, "How are you?" They're like, "Yeah, I'm fine. I'm okay. Everything's okay." When it's not okay, but they don't feel safe to be able to express that.
So by doing stuff like this today, and broadcasting to people that actually it's okay to not be okay. It's okay to have feelings. It's okay to understand your feelings. And there's some literature. There's a book that someone recommended. I've read it. It's called "The Body Keeps the Score," and you've probably had a copy. And it talks about how the body keeps the score with stress and trauma. So when we talked about illnesses and stress in our community with men, and we start thinking about illnesses, the body's a weird thing. When you're producing too much cortisol in your body, it kind of knocks your system out, your nervous system, your lymphatic system. So now you're holding on to these emotions, and emotions manifest in your body as stress. And stress, we know, is the primary killer of most people, because stress does so much. So in terms of what can we do to challenge that misconception, I think as people that come from a community that's been blessed to be able to undergo therapeutic training, it's now our duty to serve and to share and disseminate information. And it's not just about the men. It's about how do we empower the women. Because we have to acknowledge the reality. There is a lot of young men that's growing up in households where they haven't got that protective figure, that father figure. And how do we now encourage mums, aunties to connect with their sons? Because, I think about some of the roles that I've done, and like you, I've worked with serious youth violence, young men that have committed horrendous crimes. And most of them are just traumatized kids. But they've developed this thing where they've just become so cold. And when we've gone back and checked with them, I'm a big believer of attachment theory. Attachment theory, I believe in it 100%. That early attachment that we give to our young men. How do they feel safe? And if they don't feel safe, they're going to find safety somewhere else. And normally where they find that safety is spaces where they're going to be exploited, where people's going to take advantage of them. So in some of our roles, we've worked with young people that have been exploited, that's been sent out of town, up to places. So there's an organization, they do rescue and response. So when they find out that a young person's probably in Liverpool, Manchester, whatever, they will go and rescue that young person. So in regards to your question, Ryan, I think it's how do we normalize that stuff around not telling people your business? How do we normalize saying to people it's okay to not be okay? How do we normalize it's okay to invest in yourself? And when I say invest in yourself, do you give yourself time? So sometimes investments mean spending a bit of money. People think that therapy is quite expensive. I can guarantee you when people phone me for therapy, I'm a man, I will negotiate with them because I want them to access something that's going to be helpful.
Absolutely.
In certain countries, it's normal. You know, like you go into America, and it's normal for the children to have a therapist. You know, it's standard practice. So why can't our people here access therapy?
But I'm sure therapy usually originally was a middle class thing, because there's a lot of white working class that I've met in my journey as a therapist, and a lot of Asians and Chinese. They don't do therapy. Just like how the black community frowned upon it. The white working class frowned upon it also. And in my work, what I say to the people that I work with is, it shows more courage and more bravery to actually expose yourself, or expose yourself and articulate how you feel, rather than put on the front, this big hard shell that you put up in front. That's, for me, that's a weakness. So that's what I kind of put across to the people that I work with.
So there's
That
strength in being vulnerable.
Yes, the strength is the ability to articulate how you're feeling, rather than put that front on. And women do it too, because as I said to you, I've worked in Holloway Prison, and women are just the same. It's the environment. If you was brought up in an environment where your parents didn't encourage the space where you can go and sit down and talk to them, and if you did try and do that, they might say, "Oh, go and play in your room," or "Not now, I'm busy," or "Don't cry."
Certain judgments made against you. And I think one of the things that we picked up in our training is to be non-judgmental, which offers that the person in front of you to feel vulnerable, not to judge them, so they can be open and share what's going on for them, get to the heart.
Yeah. And I think that unconditional positive regard, that empathy, these core conditions that we use in the Therapeutic Alliance is what gives people that normalizing it. So how do we challenge that? Making therapy normal, making it okay to
accessible to everybody.
That's why I came up with this thing around the therapy spot, because I wanted to show people we can have therapeutic helping conversations in a non-threatening, non-judgmental way, where it's to do with the brain, and like in the prefrontal cortex of the brain, that's where our rationale is, our thinking, our logic, our empathy. But if we're always in a hypervigilant state because we're always anxious, fearful, our capacity to do this thinking together, to do this understanding together kind of goes offline. And I suppose what we then offer with our young people, with our clients, is a space for them to almost bring their prefrontal cortex back online, to have that sense of safety. So what you spoke about in the beginning, Ryan, in that therapeutic space in the rehab, something clicked in your mind and you're thinking about safety, and that allowed you to dig deeper within yourself. to become the man you are now.
Yeah, it gave me an opportunity to explore my childhood as well.
Yeah.
relationships I had with my parents and how I felt growing up as the youngest of 4 children. I often felt isolated, like I didn't have a voice and stuff like that. So yeah, it gave me a very good space. So I realised I should have been here years ago in that spot. Rather than saying raving in a nightclub, snorting
How was
coke.
that? So go on.
No, you go, Cole.
No, I was gonna say, how was that discovered? Was that through personal therapy, or that that stuff that you found out about yourself from going back into
Yeah, it was through the personal therapy.
Yeah.
Because as I mentioned earlier, prior to going into to rehab, I used to read crime magazines. So I was always interested in how the mind works, but I never thought I'd ever be a therapist. It's only when I had that time and space in the therapy, when I was sober, because once you're sober, you start feeling and thinking clearly. So once I started seeing and thinking clearly and feeling clearly, I decided, yeah, this is really good for me. And then I started to explore my relationships from childhood. How I thought from childhood. Why did I end up out on the street when the rest of my family didn't? You know, because my brothers and my sisters, they never went out on the street to hustle. I was the only one. So and my mum couldn't tell me about. She just
Kiss our teeth.
yeah.
So he said he's Jamaican. So your background,
Yeah,
from
I'm Trinidadian,
Trinidad,
Caribbean. We're all from the West Indies, isn't
Yeah.
it? So
But that's a really good point, you know, Ryan, because when we think about who we are, people then make assumptions. You're from the Caribbean, so you must be like this. But there's so much diversity in the Caribbean. So if you're from Barbados, you might have a different experience from me as a person from Jamaica, if you're from Trinidad, or if you're from... So even those aspects, when we're thinking about counselling, when we're working with... We have to be culturally competent. So if I don't know anything about Grenadian culture, and I get a client that's going... I'm going to do some research and have conversations because, again, that helps to build this alliance. So, you know, you talked about your childhood and being one of 4 brothers, and you've almost come to terms with that. So you can speak about it quite openly and you express that. And we've all done that investment in ourselves. So part of this show was, how did we invest in ourselves? And I'm going to say this categorically without any... Becoming a therapist was a painful journey because I had to understand my own stuff. And how did that help me? How did that enrich me? How did that make me better? It enabled me to understand why I functioned the way I functioned as a youth.
absolutely.
Why I hated authority. So when I started to work, I started working in my later years, like 30 odd years old. Very anti-authority. And like, used to get me into a lot of trouble in the workplace because I want to cuss them out. Like, let my tech man for Edie, I tell them things. And like, man, do the thing. But then I thought, where did that come from? And then I realized it came from growing up on an estate, going to a school, and it's weird. I was talking to someone yesterday, one of my brotherhood, and that's the next thing that I will encourage men to do. Build a brotherhood of men around you, like-minded men, men that will challenge you. So your brotherhood keeps you contained. So I have a brotherhood outside of this space, and I know those are men, they're not therapeutically trained, but I know I trust them. And we was talking about, so I grew up in Northwest London. I went to a school called Copeland School. And everyone from my estate went there. So you either left from Stonebridge or Chalk Hill and you went on the bus to this school. And the school back in the days was systemically, institutionally racist. So I was against the teachers. Then on my estate, we had all that police nonsense. Back then you had the SPG, the Special Patrol Group, used to jump out of the van, beat up man and so forth. So I hated authority and understanding your own trauma. So one of the things that used to trigger me in the workplace is when I used to see white men with Dr. Martin boots on as managers. Because in my eye, then man, there's police, bruv.
It's familiar. It's a familiar thing.
So that, and I didn't realize, and now that I'm sure, now can we see how things can trigger how we respond to stuff without even consciously knowing this is why. Why did that man in the DMs, why did I just wile him up like that? Because the DMs reminded me of the policeman's shoes. And when they used to jump out, that's what I used to see first. So when you spoke about your childhood, we need to encourage men to understand what you experienced in your childhood.
Absolutely.
And that wounded child, we call it inner child work in our field, that wounded child. How can you soothe that wounded child within that's made you the man that you are? So how do we normalize and break cycles? It's about sharing knowledge and wisdom and information. And that's where I feel quite privileged now to have been exposed to all of this training, all of this knowledge, so that I can use it in a way where I'm sharing it in my community, but in a way that makes it relatable and understandable. Because one of the things that stopped a lot of people in our community accessing therapy is what you said earlier, Ryan. Before, they used to make this a really difficult field to get into. It used to be mainly middle-class white women that didn't have anything to do, probably rich, or husbands were well off. So as part of their part-time thing, they do counselling. So when we started our journeys, when I had to look for a therapist, boy, there wasn't a lot of people that looked like, like they say you have to be in personal therapy.
Yeah, to train,
I didn't see a lot of people on the directory that looked like me. And then I saw all of these women and I'm thinking, what was your experience?
I started in 2004. When I came out of rehab, I started studying in 2004. And I went to Lambeth College. And I think I was the only black guy in the class. And it was mainly, as you mentioned, it was other people there from different professions. It's like they're doing that as a pastime. So I kind of felt very insecure in that environment initially, because not that I was illiterate, I was always a clever person, but I didn't think I was educated because I didn't go to school and get educated. I'd done all my education in prison, reading, and I got education in prison and stuff like that. So when I was first started to study, I felt out of place. I was very vulnerable, and that was one of the hardest things I had to do, is to actually sit in the classroom and to be in that environment. That was I had to be the most bravest to do that, because before that, I could be in environments where there's violence, knife fights and everything like that. I was more safe in them environments than being in a classroom.
That's what you knew.
Yeah, I felt, more vulnerable in the classroom amongst that,
Yeah, that was one of the questions that someone posed to me, which you've kind of answered. Like, what were some of the biggest challenges in becoming therapeutically trained? And you spoke about being in this new environment where if I was back in the hood, where it's all no problem, but in this new space, it was quite scary and challenging. But coming back to the topic around invested in self, that was the investment that you made in yourself to face that challenge.
Yeah.
What was the biggest challenge, or some of the challenges you had, Cole, when you was going through your training?
It's interesting you talk about personal therapy, because a lot of people don't know that in order to become a therapist, you have to experience therapy yourself. And a couple of things, what I was taught was that you need to be able to face certain things, like you face certain traumas, you face certain things. Because if you've got a client in front of you, for instance, you've not dealt with a bereavement properly yourself, and you've got a client in front of you, you can't go there with that client, So you need to work on your own stuff.
You have to work on your own
stuff.
So
that investment in yourself speaks volumes to me when you're talking about personal therapy. When I signed up with my therapist, I went with a psychodynamic therapist. I knew her from before. She was a family therapist. She come to see me when I was going through stuff with my daughter. And I took it as a tick box exercise. I'm on a course. I ain't got nothing wrong with me. Me all right. I'm going to sit down and chat to this woman. And one of the first couple of sessions, she saw straight through me. She says, yeah, you think this is a tick box exercise, isn't it? You don't need
She
this.
read you.
She read me. Yeah. And I was so, again...
Was you putting up a resistance?
100%.
Yeah.
She nicknamed me Mr. Sheen. Yeah. Everything on the surface. She didn't want to go dig deep. Yeah. She's still my therapist today. This was about 5-6 years ago. She's still my therapist today. So love that she can see me. She can actually see me. And that kind of seeing this stuff which is unconscious or unaware to us, it increases your own self-awareness. So certain things, you know, I learned that I was a people pleaser. I learned that I did certain things on and how I masked them, she uncovered them so I could work on them. So if you can't work on what you don't
It's
know.
fascinating, isn't it?
Yeah. So I love it. So
Fascinating.
that personal development in yourself, you know, I love it. So being a therapist, you have to go through therapy yourself and work on yourself.
Yeah.
And it encouraged me to do more self-development.
Absolutely.
Which I
I
love.
kind of describe therapy as gaining a third eye,
Yeah.
so you can see things deeper from a different perspective. That's the way I describe it.
Yeah.
And it also enables you. Part of me was watching her to see how therapy is done. You know, like, I'm going to try this on my clients, you know. But I feel that therapy is not something that is done. You don't train to do therapy. I think you become a therapist. You know, I think that's what happens. So you're working on an investment in yourself, you become a therapist. You know, so I think that's very important. What about you, Dwayne? What's your...
I think that's a very interesting point, because as I started by saying, I want to go out there and help people, so I'm training to be a therapist. But then you realize that you have to do so much work on yourself.
Yeah.
Because I realized that doing my essays, the theoretical part was fine. I could do that. But then I would always get back my essays with wanting like, hey, you've got to put something about yourself in there. You have to be doing all these criteria and stuff. And I'm just thinking, what is this? This is not what I signed up for. But in the end, you realize that until you started get in touch with yourself, talk about your issues, and I was able to identify my attachment style. And because I've identified my attachment style, I'm thinking, that makes sense why I'm like that, or that makes sense why this is happening. And then when I start to feel a certain way, I now know what is playing out for me. So it's just like, okay, that's fine. I know what's going on here now. I don't need to second guess it. I don't need to make it a bit bigger than it is, because I understand myself a lot more than I did before.
Yeah. Very important, man.
Yeah. I'm sitting here and I'm just reflecting on the conversation. That's where we're chopping it up. And part of what's come to my mind is that even as therapists in our own life, sometimes we can get triggered again. And it can bring us to spaces where we go back to past behaviors or past thinking.
Or
And
fantasize about it and not actually doing it.
And then sometimes you got to check yourself. So what Colin said about therapy, again, this is for people that's thinking, how did these guys do it? Part of that investment in self is we had to go into therapy ourselves, and we had to unpack a lot of our stuff. So when we're sitting down and we're working with a client, we can unpack that people pleasing, because we know there's probably aspects of ourselves where we used to people please because of fear of not having any boundaries, of wanting to be liked. So I'm not going to challenge. But when you train, what you learn is your boundaries. We learn our professional boundaries in terms of how we engage with our client, but we also learn our personal boundaries, what we will and will not deal with, how we're going to respond when we're stimulated by something. And when I say stimulated, by a conversation, by a trigger, we almost have that kind of third eye to do that thing. And Cole, you used the wonderful analogy about the iceberg. Because what I say to people with the iceberg analogy, it wasn't the tip of the iceberg that sunk the Titanic. It's what was below the waterline.
What was hidden.
So most of the time when you're thinking about relationships, when we're thinking about anger, that is the tip of the iceberg that we see. The anger is the tip. When you come into therapy, what that allows you to do for yourself is to become like a deep sea diver, to dive below the waterline. What is the thoughts that's driving the behavior? What is the feeling? What is the need? What is the desire? And then through us sharing emotional intelligence, it's allowing people to tap in. What did I really feel when I was 10 years old when Mr. Rice was smacking me with the Adidas Rom trainers. Because that's the levels that, because in my school, Mr. Rice, he used to beat us.
Yeah.
And I never forget the trainers. There was a pair of Adidas Rom. And like at school, you know, you're young. And these man, they look like giants. He looked like a giant.
And
he was a rugby player.
You don't deep it until later.
And he had a pair of size 11 Adidas Rom trainers with the white bit on the tip of the toe. And the bottom was the rubber. And that's what he used to hit us with. So by me understanding what that meant for me, makes me understand when men have suffered from violence in the home from early, because I had that violence and I suffered that. So this investment in ourselves and we understand us, and it enables us in our therapeutic work to understand. And I suppose part of this conversation is to demystify the work that we do. We're not outer space people. We're still regular people. Colin's a promoter. Ryan, when he was coming here, you said you're bucker man that you went gym with. I'm still in my community. I'm still there every day. I still have conversations. I still see what's going on. Dwayne, you're involved in the church. You're normalizing that ideology. You know, we don't talk for the business out the road. You know, we don't tell nobody what I want another house. You know, but let's keep everything. So this is part of why I wanted to bring us together, just to let people see, right, there's 4 men, look like us, sound like us, understand us, and we can access that. And there's more men. So I've got a young man now, he's in training. So I'm now his counselor. So he's invested in himself. And he's now going to be part of that new school that's coming through, that's going to normalize this stuff. And, you know, we have to think about the times we're living in now. As my granddad said, it's better to have something and not need it than to need something and not have it. And as you said, there's people that have therapists in America, like they got them on speed dial. I've got clients that I've worked with for 2 years. So normally when we start the process, we might do 6 weeks and then reevaluate it and then offer a next 6. And then they might go down to fortnightly or monthly. I got clients that I've got now where they got me on, they might not need me for 2-3 months, but they might face a challenge and they realize I'm not in a good place. Let me phone Scotty. And because we got that relationship, that alliance, I'm more flexible. So counselling used to be very rigid. Your appointment's at 6 o'clock. If you come at 6:10, then we're going to finish at 7. I'm a bit more flexible because I understand that's the nature of the beast of the men and the communities that I work with. And that's part of the thing about making counselling more accessible. We have to be a bit more fluid. And I suppose when I reflect back, our parents, did they have counsellors? Like, what was it, the elders in the community?
The
what
elders,
did they have?
isn't it? Especially if you go back to the African community, it's the village, isn't it? That was the counsellors. You talk to the elders. I don't think there was counsellors as such.
No, I don't. My parents didn't go through counselling. But there's a question I wanted to ask about, you know, the youth violence. Do you think that has anything to do with the lack of, because, you know, before we was allowed, you know, people were allowed to discipline their kids, like hit their kids. And I can't remember exactly, but it's about 20 years ago or 15 years ago when they outlawed parents being able to hit their kids. Do you think that might have something to do with the breakdown of discipline within the family household? Because I know growing up, I would get licks. They used to call it licks. You know, my dad would say, go and get the slipper or go and get the coat hanger and give me some licks. And I know you can't do that now with your children. I'm not saying you should go and do that, but I'm saying growing up in the 70s as a child, right? That was the norm.
Yeah, and I think it's a contributing factor to it. You know, because there's that kind of lack of respect when it comes to like children kind of feel like, oh, like, I know you can't lick me, so I'm going to do what I want. You know, I remember hearing stories where people said, I'm going to call Childline. And a parent will go and say, here's the number. You know what I mean? Because they're not, there's no fear there.
That's right.
There's
That's
no
what I'm
fear there.
saying,
So I do think it contributes.
I think so.
To that, you know, not being able to. Like, I remember getting some serious licks from my mum. You know what I mean? And it steered me on the right path. But I still did go out there knowing that when I come back, I'm going to get.
But you knew you was going to get licks though.
Yeah.
See, there was a deterrent there.
Yeah.
You know what I'm
definitely.
saying? But now there's not a lot of deterrent there for kids.
And I think there's a fear in parents
Yeah, because they can't
in doing that. You know, because of this.
I'm not sure though, because I think there's a way. 'Cause, I mean, I was one of those people that said, you know, John Major says you're not allowed to hit us.
Tony Blair and him.
Tony Blair and Esther Ransom.
So I remember when I was younger, he was like the prime minister at the time. But I don't know, because I mean, I think there's a whole other conversation.
Another conversation.
Because then that goes into enhance about contributing to trauma that the child already have, and you know, abuse. It's just a whole other. But I mean, I think there are ways that you can do things now that, like for me growing up, you know, like with my gran, all she had to do was just to look at me.
Yeah.
There was nothing. It was just a look, and then you just know you have to fix up. It's just so. I think there are ways without having to actually become physical. I think.
And in regards to Ryan's question about serious youth violence, that's an episode for itself because, as Colin said, there's so much contributing factors.
Absolutely.
It's not just about not being able to discipline the child. I say this when I go out and I work with young people now. I would hate to be 10, 11, 12, 13 now because the pressures are too much.
Immense.
We didn't have those pressures. We didn't have those same things. So that conversation about serious youth violence and chastising children and the trauma that it can elicit, that's a different conversation in terms of what are some of the contributing factors. And I'm thinking now, you know, we've chopped it up a little bit today. Maybe depending on how people feel, maybe we might have to come back and we might have to now chop up that conversation around actually my background, youth offending. My background is working in London, there's 4 major trauma centres. I worked in one for 4 years in an ED department, specifically with young people that had been impacted by serious youth violence, stabbed, shot, exploited. So, you know, there's lots of information and that I've garnered doing that work. Your work that you do now with young people, your work in the criminal justice system. So that conversation about serious youth violence is another conversation, but it's a contributing factor to men's health and well-being in general, because those people that are being victims now, they're tomorrow's dads. They're tomorrow's men. And if they've grown up just knowing violence, then what does that do for their children? And we spoke about attachment theory and all the nuances of that. So like, I think that definitely is one of the subjects that we'll have to chop up again. And I think that our conversation here today has kind of demystified some of the things around therapy. It spoke about how we invested in ourselves. It spoke about the modalities that we might use. It spoke about psychodynamic. It spoke about person-centered. You guys kind of enriched everyone with the core conditions that we use in our work of providing that confidentiality, that safety. And we've also demystified some of the things about, you know, don't tell people your business. No, in a confidential space, you can 100% share your most vulnerable part. And that's what we've done today, talking about being one of 4 children, me talking about how Mr. Rice used to beat me, Colin sharing how his name was Mr. Sheen because he never used to, but now his name is probably, you know, Mr. Glass, because now you're open, you're just here. And there's a thing that we've done here today is we've shown humility, courtesy, respect, understanding, compassion. We've been curious. And these are all the things that you need to do when you're investing in yourself. As a man, you need to be compassionate to yourself.
Also non-judgmental.
You have to be non-judgmental of the things that you've suffered.
Yeah.
You have to speak kind to yourself. You have to speak to the king in you. So much men are used to speaking to the wounded child in them. You have to be courteous to yourself. And once you develop these skills and invest in yourself, it allows you to then invest in your interpersonal relationships, your friendships, your business. So like for me, I know all of you guys, and I really do appreciate that you've given up some time this evening, that you've been open to share your knowledge, your journey. And this is what we need to do to improve the mental well-being of men, to broadcast and to show that it's okay. So before we wrap up and finish, I just want to get some finishing words from all of you in terms of what's your reflection on the conversation and how you feel about where we were today. So Dwayne, what's your reflection on where we traveled today?
I mean, I think it was interesting for us to come together, realize that although we are all black men, there's different culture, different experiences that we all bring. Yeah.
the differences, and how we have
Yeah.
to be really competent in understanding them.
Yeah.
Thank you. Ryan, what's your...
My reflections is it was very important, I think, for us to get together and talk about this. But as you looked at your watch to say we've run out of time, it made me realise that there's so much more stuff that we need to talk about. Because I'm thinking if there's any young women out there watching this particular, they might be thinking, what about us? We haven't spoke a lot about young women in society today who also go through a lot of stress and traumas. So I think it was very informative. I think it can also be very helpful. But I think there's a lot of more work and a lot more discussions to be taken around youth violence, and even older men and older women who haven't accessed therapy and are still dysfunctional today as big people.
100.
So your takeaway is that actually we need to do more of the therapy
there's a
spot,
lot
and we
more
need
to
to
do. There's a
have
lot
some
more to-
different subjects that we can chop up.
Yes.
And I call it dancing when we're dancing with
Yeah.
our thinking.
There's
So
a
that's
lot
a
more
takeaway.
discussions to have.
And I think if I was to say, right, Dwayne, Ryan, Cole, let's come back in a couple months' time and like these things were said, and let's chop it up a little bit more
yeah.
from our therapeutic lens will be helpful.
Absolutely.
Okay, brilliant.
Yeah, I definitely
Cole,
agree.
what's your
Definitely agree with that. I think it's important, this conversation today. I've told my story in bits to other people, but this is the first time it's felt like it's been in its entirety. And although we're from different backgrounds and different, there's a lot of similarities that we've experienced through our training. And I'm hoping that through doing this, that we have demystified some of the things about therapy and chatting people's business or what we do, you know, and there is help out here for people, you know.
Brilliant. Thank you for that. So
Just
it's
before
about
you finish, can I just
demystifying.
say,
Of course.
whoever's watching this, don't ever be scared to reach out for help.
Yeah.
Right, because that's one thing in the community, the stigma.
Yeah.
So don't be scared to reach out for help.
Okay. I've already kind of touched in and said, you know, I really appreciate the time that you guys have given. I really appreciate your professionalism. I really appreciate your commitment to be here and to be open and honest. And as I said, big shout out to the studio that we're using. This is the studio. The owner, he's part of the people that sponsor this. He allows us to come here, and he's brought into the process because he can see the value in it. So I'm really hopeful that we get some feedback and there's some conversations that we'll have to come back. And if I was to invite you guys back to again, would you be a thumbs up?
Without a doubt.
Yeah,
without a doubt.
Absolutely.
Yeah.
Without a doubt?
Yeah.
Okay, so for the people watching outside, this is Dwayne, this is Ryan, this is Colin. Our details will be on there. I'm Scotty, I'm the host, and I look forward to speaking to you at the next episode of the Therapy Spot in potentially December. So thank you for tuning in.
Good.
God bless and,
Nice to
and
meet
take
you.
care.
Nice to
Thank
meet
you.
you.
Bye.
Respect.
Thanks.